of Graduate Admissions, and thank you for coming to our workshop Wednesday today. Just to give you a little bit of information on how to prepare for your DNP interview. I think I have one. Okay, yep, everybody is here. So yeah, let's just get started. So on the agenda today, we're just talking about what you would want to do to make your DNP application stand out, what to do to prepare for your interview, what we are specifically looking for when we evaluate your applications, what type of questions ask, and what to do after the interview. And lastly, advice from our experts. Our experts are on, so we have Dr. Veronica Petrini and Phyllis Levito. She's one of the academic program specialists that help with the evaluations and the interviews. And lastly, just if you guys have any questions at the end of the presentation, we're definitely here for questions. So is what makes applicant competitive? So for the fall of 2023, we are on rolling admissions and there is no perfect applicant. So we generally ask for a 3.0 science and cumulative GPA. Of course, to answer the essay question and focusing on your interest in patient care and why you would want a DNP. We definitely look for your letters of recommendations to be strong from qualified colleagues and or professors if you want to do an academic or professional. And we also look at your experience. Depending on your specialty of choice, your experience matters. And we ask that you design your CV or resume to clearly reflect your expertise in the field. So I just want to make a disclaimer that not everyone gets an interview for the DNP program. Now, if you are invited for an interview, you are on the next step of possibly getting admitted into the program. So you should just be proud of just getting an interview invite. So with that being said, if you are already invited for an interview, congratulations. You've at least made it through the halfway through the process. So once you get an invitation for an interview, usually it's via email. But next we're just going to talk about how to prepare once you get that email and get to this point. So what can you do to prepare once you get that email asking if you would like to come and speak with us? We ask that you do your homework. Once again, check your email because things change. Things may need to get moved up or moved back. And you can reach out to us if things change in your life. We know work, children, your life outside of school is equally important. So please let us know if anything changes or if you need to push possibly your interview back or maybe change a time. We ask that you review the AACN essentials in advance, where we usually send a link within that email for the interview. It's kind of like a link, or you can search it yourself, but we ask that you at least review that. We ask that you attend a DNP online chat. We usually host one once a month, just so you can ask questions from our specialty directors or me, Nataki Big Dave, just to once again prepare for that interview. And also review your specialty FAQs. So depending on your specialty, your experience may change, what your requirements may change, it just depends. So definitely look at the FAQs when you are preparing for your interview. So what qualities are we looking for in our DNP candidates? So just to pull some words, we ask for a positive attitude, timeliness, kindness, integrity, hardworking, flexible, being determined, having a good sense of leadership and professionalism, and just a sense of humor. So, I mean, we ask that, of course, you bring these things to your interview, but we also want you to reflect that in your essay, just so we can get a good feel for who you are before we even invite you for an interview. So what kinds of questions do we typically ask in the interview? So just a quick 4. I mean, of course, there'll be more questions in the interview, but one is why? Why do you want to be an MP? Why do you want to get your DNP? What are your strengths? What are your areas of growth? We ask that you be reflective and figure out what your strong suits are and where can you possibly do a little bit more work. And then our advisors, of course, if you're admitted to the program, help you with those areas of growth and your strengths. How do you manage stress? NP programs can be stressful. There's going to be a lot of clinical rotations. There's going to be a lot of time management. You're adding on another full-time kind of job to your already busy life. And who is a mentor to you and why? So think about those questions when you are on your way to an interview, or maybe just like write those types of questions down and give yourself that answer just so you can reflect on them before you get into the interview. So you've done the interview already. What's next? So after the interview, the admissions committee deliberates and pretty much reevaluates your application after speaking with you, and then gives me an update. And all updates as far as your application decisions are going to be made via email. So we ask that you check your email consistently, at least maybe once or twice a week. And also reach out if you have any questions. So it's okay to be nervous and anxious. This is a whole nother kind of venture, a whole nother thing that's added to your already, once again, busy life. So if you feel anxious or nervous, please reach out to me if you have any questions. Just about the program, about possibly like your interview, or if you just haven't heard anything back for a while, please reach out. And then also consider coursework only. So a lot of students will possibly want to get like a head start on their DNP courses. So in the very first semester, there are some courses that are offered as a coursework only option. You can take up to 2 classes without necessarily being in the program, just to get some of those classes out of the way, just to have something to do in the meantime while you're waiting. So next I'm going to hand it off to Phyllis Levito. She is our Senior Academic Service Specialist in Family and Community Health, and she helps with interviews as well.
Hi, good afternoon, everyone. So if you are applying to the DNP specialties of pediatrics, either acute care or primary care, psych, mental health, family nurse practitioners, neonatal, did I miss anyone? Okay. You will receive an email from me if you're going to be invited for an interview. And in that email, I will ask you for your availability, and don't be scared by the dates. We will work within your schedule because we know that we're working with busy nurses, and we'll schedule an interview with the appropriate specialty. Once we have determined a date together, I will send you a confirmation email confirming the date and time, and followed by a WebEx appointment. We're doing virtual interviews via WebEx. And so what that means is that we're going to do it online virtually, but we expect that you're going to behave and look the same way that you would in person. So we want you to be professional. We want you to be dressed appropriately. We want you to be at your absolute best, because this is the only time that you're going to be able to meet with the faculty in that specialty and give your best first impression. After the interview, also within that confirmation email that I send, I asked you to go to the specialty's webpage and look at it. Look at the courses, look at what's expected of you, so that you can so that you'll be prepared for the interview as well as be able to ask questions. We want you to have the best opportunity to know exactly what you're getting into before you make the decision to either accept your admission or not. And again, as Nataki said, coursework only is a great opportunity for you to get a feel for what a graduate course is like. It's not like undergraduate nursing school. It's just not. And so we want you to be prepared. We want you to do your best. Our goal is to make you successful, and we want to be able to help you be successful.
Thank you, Phyllis. And next, we're going to get some advice from Dr. Veronica Quattrini.
Good afternoon, everyone. First, I want to say thank you to Nataki for hosting this. I think it's really important because a lot of folks are very concerned about the interview and what they can do to prepare. And I will tell you, listen to Phyllis. She's been around a long time. She knows the ins and outs. If you get an email from her, I suggest you reply and you follow it to the letter, because you'll often hear me say, what would Phyllis do? I'm the senior director for the DNP program. What Phyllis outlined in terms of specialties is a portion, but she is responsible for a large portion. We also have the CRNA students, which are our nurse anesthesia students, as well as our adult primary care and acute care specialties. The other piece that I wanted to reflect back on was when Nataki talked about the DNP chat. What's really nice about that is every month, Dr. Isaac, who's the associate dean for the DNP program, and we alternate months, and we host a chat with someone like Nataki or someone else in admissions. And what we do is we talk about both aspects of coming back for your doctoral education, both from a curricular standpoint, as well as from what you need to do in terms of your application, etc. So I highly encourage you to share that with any of your colleagues who are talking about possibly coming back to school. As Phyllis mentioned, this is a very rigorous program. We are in the process of looking at the new essentials, and with that, we're going to be recreating curriculum to have competency-based education. Everything we do is reflected in the DNP essentials, as well as the certification boards for each specialty. So, you know, as far as what Phyllis brought up, that's the things that we are looking for: professionalism, whether you're face-to-face for your interview or virtual, as well as the things that Nataki highlighted earlier. You'll find on the website, there is a one-pager that I did, as well as that Dr. Isaac did, on just some bullets about preparation for your interview and what we're looking for. The other thing that I wanted to share, and I'm not sure if it's in the email from Phyllis or not, but you're typically going to be interviewing with either 2 to 3 faculty in that specialty. So you're going to have a variety of folks asking you questions. And I can assure you, if you're interested in family, we're going to be asking why family versus pediatric or adult, and whether it be acute care or primary care for both of those specialties, because family, you really need to have experience in everybody across the lifespan, because in family we see across the lifespan. So you will get questioned on that if that's an area of interest. And I think that's probably just as much of an overview as I want to give, and then depending upon what Nataki has lined up next. But when she allows you all to ask questions, you'll probably be able to ask more specific questions. Just like the DNP chat, you'll hear what other folks are thinking and perhaps will answer your question.
Thanks. So actually the next slide is just, what questions do you guys have? Try to allow enough time for questions, because I know some people are anxious about the interview. Some people may be in the very first parts of their application and want to know how to prepare early on. So please ask any questions that you have in the chat, or you can unmute yourself and ask any questions that you may have for any of us.
Actually, this is Charles Baker. I was curious about how much focus is there on clinical knowledge in the interview? Or are you looking more for a general overview?
Maybe if y'all want to direct the question at one of us, just so that we're not all talking over each other, that might be helpful. Charles, was that directed to me?
I'm sorry, here, I'm just in general for the interview. Is it more of a, well, what's the clinical focus in the interview going to be? Is it going to be more of a general clinical focus? Or are you looking at more of specific clinical knowledge and detail oriented? Just kind of just curious on that aspect.
So I can tell you, after interviewing different candidates, we are going to ask you different questions that I think are a little bit more generalized. In terms of your clinical focus, I think that that has a lot to do with what area of specialty that you're looking at, but I'm not sure I'm answering your question.
I mean, that's kind of it. I just wasn't sure if you guys delved into, I've been in so many different interviews in my life. Some people get very into details of calculating IV drip or,
Oh, no.
Is it
No.
going to go into any of that? Just curious what review on that side I need.
I don't think that that's something that you really need to think about being able to present. Some of the kinds of questions we ask are a little more general, like in your clinical practice, can you tell us something that you're really proud of that you did, or something that you feel that you could work on, those kinds of things. Nothing, nothing that specific. Because
Okay.
you have to remember, this is when you're coming from a BSN to a DNP, we're looking at two areas of focus. One, of course, is a clinical focus, but then there's also a leadership focus and the ability to do a quality improvement project. So there's really two major focuses that we're looking at here.
Okay, good. That answers my question. Thank you.
Of course.
Charles, may I ask you what specialty you might be interested in?
Maybe the adult gerontology. I had a lot of time in as nursing homes, doing rehab, stuff like that, where I spent a lot of time with the elderly, both in acute care and the rehab setting. So that's
okay. So I think when you have done your application, your essay will be very specific as to why you're choosing that particular specialty, and your background in that area. So
okay.
Why it is that you're interested in that area, and how it is that you think that getting a DNP is going to improve the way that you are able to serve those patients.
Okay, good. Perfect.
And the other thing I want to share is our website is just a wealth of information. And so, for example, if there's anybody on the call that is interested in, just say, for example, the neonatal nurse practitioner program, there is specific information as far as what the specialty director is looking for in terms of work experience and what the timeline is to have that experience. So, and I think also what you'll find on there on that on the website is those one-pagers that I was talking about that both Dr. Isaac and I had put together for your interviewing. But as Phyllis just mentioned, I think that the essay really does help to showcase what you've done and what your interest is and why.
So I have a question in the chat. Ellen asks, what would a perfect strong interview look like? For example, what are you looking for in a strong interview?
I think that that's something that really comes across that most of the faculty can see is when a candidate is really interested in the program and has a strong vision as to why they want to pursue a specific specialty and why they want to also pursue a DNP, as well as the ability to showcase what they've done to be able to support this rigorous program, and the fact that they're honest, they're able to be flexible, professional, trustworthy. I don't think there's a perfect interview by any means. And I think that it's just that you need to come prepared and honest. And that, I think those are the two big things: prepared and honest and professional. Phyllis, you see a lot of our responses on candidates' interviews. Is there anything that you want to add?
So no, actually, I think you've really covered it all. We're really looking for the well-rounded person. So, and if you've gotten as far as an interview, something has stood out in your application. So you're more than halfway there at that point. So really, it's like going out for a job interview. You just want to put forth the best person that you are. And we ask questions also based on like your time commitment, because we know that all of you are working. But honestly, we can say this without any question: you cannot work full time and do these programs. You have to cut back on your hours. And in your interview, those faculty are going to ask you how you plan on cutting back on your hours. And how do you plan on making the time commitment to do a graduate program? So those are the types of things that you really need to be prepared for when you're coming in for an interview.
And just to add to what Phyllis said, we've got several different, and I'll let you ask your question. I'm sorry, I didn't see your hand up. But I just want to add a couple of things to what Phyllis said. First of all, and we cover this in the DNP chat. In the beginning, there's a lot of online coursework and hybrid coursework. But when you get into the core work, when you get into advanced health assessment, that's where it all starts. And you're expected to be on campus. And as you progress through the curriculum, your commitment for both clinical and practicum work, which is more of the DNP leadership and project work, is going to become more and more intense. And we're going to be asking more of a time commitment that you don't really have the flexibility. You are at the mercy of your preceptors and their schedules, because you have a certain amount of clinical hours and practicum hours that you have to meet. So I feel like two things. You need to think about your life and your social life, and this is not a race. That is why we have the 5-year plan of study. We have different plans of study based upon people's lives. So that's the first thing. And the second thing is, as you progress, you're going to need to give more and more of a commitment to the program versus your job. And so go ahead. I'm sorry. And I don't know how to pronounce your first name, so I'm sorry. Is it Sanzo?
Let's see if I can get in the
So either Sanzo or Lindsay, both of your hands are up. You're going to have to unmute if you want to ask your questions.
Yes, ma'am. Hi. Oh, I'll wait. I see Sanzo just unmuted.
Yeah.
Thank you.
I just wanted to know, anyway, I missed some points for the first part of the interview because of issues of poor network. So I just want to find out when is the interviews and the dressing code and which areas are you going to tackle? So I've missed the first part and the second part because of poor network. Sure.
So you were asking when are the interviews and what the dress codes are and what, and I'm sorry, I don't think I got the third question. I know you missed a good part of it because of internet issues. Was that it?
Yeah, the third question is I just want to have I just want to have a clear mind of what areas are you going to tackle on the issues of the interviews.
So depending on what program, what specialty that you've applied for will really determine the dates that interviews are being had. So I can share with you that if you've interviewed for any of the pediatrics, family nurse practitioner, psych, or NNP, neonatal, that our interviews are taking place in January, the first 3 weeks of January on various dates. I can't speak to the other specialties, but when I send out an email message to those people who will be invited for interviews, the dates are all there and the times. The other thing that I want you to know is that if those times and dates don't work for your schedule, because we know that schedules for nurses are out a month or so in advance, that we will work with your schedule to make sure that we can fit in an interview on a day that you'll be off. We would rather have you on an off day when you're not working than try to have you interview on a 30-minute lunch break that you might not get.
Oh. Okay, fine, I understand.
Did that answer your question? And as far as how to dress, you dress professionally. As if you were coming in for an in-person interview, you would dress the same way that for a virtual interview.
Oh. Okay, fine, I understand. Sure.
Any other questions related to that?
No.
Okay, Lindsay?
Yes, ma'am. Thank you. So I have 2 questions. One of them is for you, Phyllis, if you don't mind. And this one is about notification for interviews. So in the event that you are not selected to interview, what type of notification will you receive? And will there be an opportunity for feedback if you wanted to apply in a later application cycle?
So I'm actually going to have Nataki
thank you.
answer your first question
Sorry.
about what kind of notification you get if you're not selected for an interview, because I only send out happy news.
Yeah, it's me. I'm the villain. So I send out the updates if you are not invited for an interview. So once I get kind of the word that if either or, good news or bad news, I usually send out the email communications. Now, as far as feedback, if you personally ask for feedback, I will personally ask the specialty directors or anybody that is on the interview for any type of feedback to give you to work on for the next possible application that you do for the next semester.
So Lindsay, may I ask you what specialty you are considering?
Yes, ma'am. So I applied already for the November 1st. So I'm sitting here thinking, oh gosh, I hope that essay is good enough. I applied for the adult gerontology, acute care nurse practitioner, and clinical nurse specialist blended program.
I can assure you that I'm sure that your essay was probably fine. And I can also tell you that we cast a very, very wide net. So we are interviewing more people than we're not interviewing.
Got it.
Okay. So, so I wouldn't worry too much about not being invited for an interview. If all of your application is Nataki, can they see whether or not their application is complete online? Yes.
Yep.
So if
Mhm.
your application is complete and ready for review, then we just need to give the faculty in that area, in adult, time to actually review your application and then send out an invitation to you. So it could take a couple weeks before you'll hear something.
Okay, great. Thank you.
You're very welcome.
And Dr. Quattrini, I had a question that I think may be best directed to you, if you don't mind.
Sure.
So, you know, in my specific situation, I've been doing clinical sustainment hours in critical care, but I've been in more of an administrative and leadership role the last couple of years. Do y'all prefer to see that applicants are actively working bedside and direct patient care? Is that something I should be looking into making a move leading into the program? Or is that something that if I've managed the skill sustainment and can show the experience, that I'll be okay going into the program if I were selected?
So I think that is, so have you been doing any bedside patient care in the past couple of years in your leadership position?
Yes, I'm one of those in all the charge rounds, all the RRTs, all the codes, as well as maintaining my CCRN.
Okay. Yeah. So, I mean, as long as, you know, when we have nurses who are coming that want to get into, you know, one of the NP specialties, and they, you know, they've been doing what's care management, or I can't remember the title, but they haven't really had any, you know, patient care in 5 years. That tends to be a bit of a barrier. Whereas if you're in a leadership position and you're still, you know, getting into the patient bedside, you know, and still very current on all those things, I can't imagine that being a problem. My suggestion would be when you get to the interview with the acute, you know, adult acute care team, I would be asking those questions.
Got it. Thank you so much.
Of course. Anybody else?
Okay. Well, if nobody else has any questions, my contact information is here. So if you have any questions afterwards that you think of after our presentation, you can definitely reach out to me. But thank you all for attending, and we hope to see you in an interview soon.
Thank you, everybody, for your time.
Have a good rest of your day.
Mhm.